Hey guys, this is Andrew Lee, your health insurance guy, and today we're going to chat about turning 65 for seniors. Now, I want to use that word senior lightly because I know 65 is a new 55, and I can't believe we're already here. And some of you guys can't believe you guys are already here. I just wanted to walk you through some common misconceptions. I'm going to give you my top five. So, common misconception number one, it's all free because I paid into it my whole life. Yes, that's true to an extent. So Medicare is comprised of A and B. Again, I'm not going to get into all the alphabet soup here because I'm not trying to confuse you guys. But with Part A, that's going to be your hospital coverage. Part B are the doctors that fill the hospital. Now, Part A, if you've worked 40 quarters or equivalent to 10 years into your FICA taxes, just like how I am now, then you're entitled to Part A, which is the hospital coverage. Now, for Part B, that's going to actually be your doctor's coverage. Now, there is a premium associated with that. In 2026, that'll be $203, just about, and 90 cents. And you do have to pay a premium for that. So, yes, while Part A is going to be covered at 100%, Part B does have a premium with it. Now, Part A and B equals original Medicare. And once you have original Medicare, you get that red, white, and blue card that everybody on original Medicare gets. Now, I also am signed up automatically into Medicare when I turn 65. That again is a common misconception. Not everybody gets automatic Medicare when they turn 65. So people who are drawing Social Security and also people on the Medicaid, Medi-Cal system, uh, those people will start the uh, Medicare process automatically. Now, if you aren't in any of those camps, then you will be paying quarterly for Part B, and also you'd have to apply by going into the Social Security office, going online to apply on the Social Security website, calling 1-800-Medicare, any of those avenues. And once you do that, then from then only will you get Medicare if you're not on Medi-Cal or not on Social Security. A lot of people get hung up on that still. So I just wanted to clarify that just because I wanted to make sure I'm doing my due diligence here. Now, Medicare itself covers dental, vision, hearing, and long-term care, right? No, that's a common misconception as well too. So A and B, doctors and hospitals, right? Those are the only ones, the only coverages that Medicare in its entirety would cover. Now, there are specific factions of Medicare like C, which is a Medicare Advantage plan, or D, which is a drug plan, D for drugs, and also a Medicare supplement, like Plan Gs and things like that. And again, this is alphabet soup, so I'm trying to keep this pretty light. But some of those programs will include dental, vision, and hearing, and something like a Medi-Cal IHSS would cover true home health coverage, and generally Medicare does not cover those essential extras, let's call it, and those holes in your coverage. Now, I can't wait until I get sick to get good coverage. So that's a weird one, right? Because many seniors think that they can just go up to a supplement from a Medicare Advantage plan, and that just really is not the case. If you're in a Medicare Advantage program, which is generally a HMO or a PPO, commonly known as Part C, and if you didn't enroll during the 3 months before your 65th birthday, your birthday month, and 3 months thereafter on a guaranteed issue for your Medicare supplement, then you would have to be going through underwriting again if you wanted to go on a Medicare supplement plan, which is the plan where you're free to roam anywhere original Medicare is accepted. But if you're on a Medicare Advantage plan and then you do get some kind of condition, call it a heart attack, God forbid, cancer, stroke, anything serious like that, and from then you wanted to go up to a Medicare supplement, but just did not want to pay for that while you were close to 65, then guess what? You're going to be subject to medical underwriting, so you can't just switch from a Medicare Advantage to a supplement. Now, you can go vice versa. you can switch from a Medicare supplement to a Medicare Advantage plan, and you can change that Medicare supplement plan because you're going to have a Part D standalone with the supplement because supplements that only supplement A and B, doctors and hospitals, don't cover medication. So what you'd have to do is switch over that standalone Part D to a Medicare Advantage plan that has a prescription drug plan during the annual election period, which is October 15th to December 7th of every year. And uh, once you do that, then of course during that time period you can switch over. But just wanted to clarify this because I do get this question a lot. Now, if I'm still working, do I have to switch to Medicare? The answer is you do have to have credible coverage in place if you did not want to get the penalties that accrue on Part B. There is a penalty associated with not having Part B, the doctor coverage. So if you do have credible coverage through your employer, then you can reinstate your Part B later or prolong your Part B for a later time and keep your employer coverage, but at the very least, uh, you have to report that and let them know that you do have employer coverage or credible coverage, and then you can pay for Part B at a later date. So just wanted to give you the myth versus the reality, and I know a lot of people get hung up on that. So hopefully this video helped, and I'll see you at the next one. Please like and subscribe if you did like this content. Thank you.